Good evening, everyone. This is Sonia Liebendorfer. I am going to be talking to you tonight about the wild type of amyloidosis. And this is actually the fifth type of in the series that we have been talking about. And this particular type differs from the other types in a number of ways. And we're going to go over that as we get through this information. But primarily, you need to know that this particular type used to be called the senile type. And the reason that they called it that was because this type does not show up until people are older in age. Now, this used to be called either senile systemic amyloidosis or senile cardiac amyloidosis, but there became a problem with saying the word senile. So to make everything politically correct, they changed the name of it to called wild type. Now, it's not directly related to dementias in the elderly, but it is related to conditions of aging. This particular type is called ATTRWT. The A is for amyloid. The TTR, you will recall, is a transporting protein of, the second T is for thyroxine, and the R is for the retinol binding protein that transports it to where it needs to go. Now, the WT is, of course, wild type, but it is different than the regular ATTR because this particular type is not genetic. And we're going to go into that because that makes a huge difference with this one. All right, now a couple of things about the wild type. We know that it used to be called the senile type, and they changed that name because it wasn't politically correct to call it the senile type anymore. We know that this type is not genetic. We know that it normally happens in men instead of women, and it's usually around the age of 75 to 80 whenever it becomes diagnosed. Now, there are some early warning signs that you need to watch for when you're younger. If you start developing problems with carpal tunnel, if you start having problems with a biceps tendon tear or rupture, or if you start having problems with the lumbar spine and spinal stenosis, these are warning signs that you may have this type later on in your life. All right, so let's get into it. Why is it called the wild type? Well, we've talked about previous types of the ATTR and the non-TTR, and they were familial in origin and also genetic in origin. We've also talked about the AA types and the AL types, which are also familial and also systemic in origin. And it really comes down to this is not genetic in origin. There's something that causes the protein to start breaking apart and start misfolding and depositing the protein fibrils that are formed, like we showed in that picture, in the organs. And this particular type, the heart, is what's really changed and affected. So we're going to go into exactly how it changes the heart and how it actually affects the ability of the heart to work. Okay, well, let's go over real quickly. How does this particular type change your heart? Well, for number one, those extra protein deposits make the heart stiff. They make it where it can't beat as well as what it used to, which makes it difficult for it to fill. And this leads to rhythm problems because most of them are AFib related. Because there's a filling problem, the heart starts working to try to keep up with the body's demands on it. And because it can't fill as much, it starts running into a problem with keeping up with the demand. So this extra workload that you have on the heart and trying to keep up with the demands when it can't feel as much ends up leading to heart failure because everything starts to back up because it's having trouble keeping up. All right, so now we're going to look at this graphic here. This is a wonderful graphic put out by the Amyloidosis Foundation, and they really are great at giving tools for patients and their families to understand what is going on. So let's look at this little picture of this little old man and look at some of the signs and symptoms of things that are going on with him so we can get a better understanding, shall we? He complaints of fatigue, complaints of shortness of breath, especially on exertion, complaints of dizziness. Now, complaints of dizziness really need to be explored in the elderly because it can be due in anything from not taking enough input in and getting dehydrated to inner ear trouble. A condition called vertigo is really common in the elderly if they complain the room is spinning. So it can be a lot of different things with the elderly. So it's really difficult to just say dizziness. You have to find out what the cause of that dizziness is. And especially in the elderly with the dizziness, if it's a new problem, you really need to be mindful of what is causing it. Is it change in position that's making them dizzy, or is it something else? Also, if they're complaining that they are having irregular heartbeat, or if they've been seen in the hospital for a regular heartbeat, or if they complain that their heart they feel like it beats too rapid, then followed by beating too slow, anything like that is kind of a warning flag. And then you also need to look for swelling, especially in their legs. And anybody that had a history of carpal tunnel, spinal stenosis, pain in the back of the leg, or anything like that can be Achilles heel rupture or can be biceps tear rupture. Anything like that in your history, you need to be mindful of this type of amyloidosis because that's how it presents when you're younger. When you get older, that's when these cardiac symptoms start to develop. So the earlier that you can get genetic testing done to find out if you have this type, the better off that you're going to be. All right, now just to add to that graphic a little bit. Say you're a family member that has an older person in your family that has symptoms of saying that they feel like their heart's racing or symptoms of palpitations and all, and you take them to the doctor and they do an EKG and they say, oh, they have a diagnosis of atrial fibrillation. Well, this kind of was in the back of my mind whenever I took my own mother to be seen by a doctor, a cardiologist here in the Columbus area, because her mother had atrial fibrillation. And I'm like, okay, is this a genetic thing? Or is this just a familial problem once they get in their 80s? I mean, what's going on here? So I expressed my concerns to the physician about my concern for the amyloidosis because I kind of was suspicious with that there might be some of this in the family. And the diagnosis of heart failure, they haven't diagnosed her with heart failure yet, but I know she has it because she has a lot of swelling in her lower extremities that she doesn't complain about, but I've noticed it. And she also has shortness of breath on exertion, which she hasn't complained about, but I've noticed it. So I think a lot of times your family members will be having issues, but they are so used to just compensating for them and going on and doing things in spite of it that they just don't realize that there's really a problem there because it's gradually developed. They've just gotten used to adapting and overcoming and going on. Remember about the dizziness to make sure you check for vertigo. If they're complaining of the room spinning, it's more likely vertigo than anything to do with this particular illness. But if they're complaining of fatigue, that can be a concern that their body is not getting enough oxygen for some reason. That's usually a hint about a filling problem. The stiffening of the heart that we talked about, the inability of the blood to get to where it needs to go, the inability of the filling effect of the heart to be able to push it out to where it needs to go because that heart is getting stiff. And you particularly want to be concerned if you have a history of spinal stenosis of the lumbar spine, history of carpal tunnel, or a biceps tendon or ruptured Achilles when you were younger. Because these are all symptoms that something is going to be amiss later on, and that's why genetic testing is so important. Catching it early is the key. All right, now there's a couple of things that I want to really warn you about with this wild type because it's underdiagnosed and it's dismissed because there's a lot of old people that have heart issues later in life. I mean, it's just a given. If they're over 80, then you can pretty much, well, bet that the rhythm maker of the heart, the pacemaker of the heart, is going to start to give out because, hey, it's been doing its job for an awful long time. But we have also shown that that can be a problem that's part of the cardiomyopathy that's associated with amyloidosis. Now, they've come out with some medications for the ATTR type, which I've covered in another presentation about the ATTR treatment options. So if you're interested in that, I will link it to this video if I can. Otherwise, it's going to be in the video list here of the different videos that I have on amyloidosis because this is number 5 of the types that we've talked about. So be aware that they do have medications for this. However, you have to use caution with these medications in the elderly. All right, now I want to give you a word of warning because the first thing they want to do with anybody that's got AFib is make sure that they put them on a beta blocker to keep their heart in rhythm. And that is the number one way to keep a heart in rhythm is a beta blocker. And I talk about that in one of my presentations on the pharmacological drugs that are used for keeping the heart in rhythm. It is a good idea to keep the heart in rhythm. However, for these people, it's not really a great idea, and here's why. If you have a heart that can't fill properly because it's stiff, because it has additional proteins on it that it's not supposed to have, but it's got additional protein deposits there that have made it stiff, and it knows that it needs to speed up to meet the demands of the body and meet the demands that are being placed on it. What do you think is going to happen whenever you slow that heart rate down? Well, if you slow the rate, you're going to slow down the ability to get the blood pumping to the brain. So then you understand how you can start seeing signs of cognitive decline. Because if you cut down on one of two things, either the nutrients or the oxygen, because the brain functions on two things, glucose and oxygen, if you cut down either one of those things in its ability to get to the brain, guess what? Function's going to start to decline. And it might not just be cognitive function. It might be other things as well. Physical mobility might start to be a problem. if their blood can't pump and get the nutrients to where they need to be. So all of this can start to snowball, and I want you to understand that. When you start thinking of, number one, controlling a rate, that this can kind of snowball on you if this is the underlying problem. So the main thing that we need to do for these folks is make sure we get a correct diagnosis, because to not do so is going to cause them harm. So how are we going to make sure that we get the right diagnosis of the wild type of amyloidosis for these folks? First thing we've got to do is a nuclear medicine scan of the heart. Look for these deposits. Then they need to do blood testing as well. Make sure they do a blood test for genetic sequencing to make sure that it is not a genetic form of AL we are dealing with here. The AL is a systemic form that's caused by rheumatoid arthritis, can be caused by conditions such as lupus, such as Crohn's, such as other genetic illnesses passed on down the line, and that it's not a type that is caused by light chain mutations in the immune system. If it's caused by light chains in the immune system, then we've got a whole nother realm of genetic testing to have to deal with that's going to require biopsies. They have to do the biopsies to tell about an AL type, to know what they are dealing with, because that involves chemotherapy, that involves immunotherapy, it involves steroid treatments and everything else to get it under control. But you are looking at biopsies if you are looking at an AL amyloidosis instead. So it's important that they do the appropriate tests for typing. We've talked about 5 different types, and I'm not going to go into all of the different testing and all of that here, because if you want more information, you can go back and reference all of the presentations I've already done on all of the other types. I encourage you to get genetic testing if you have any of the 3 problems that we mentioned at an earlier age in your life: carpal tunnel, spinal stenosis, a biceps tendon tear or rupture, or Achilles tendon tear or rupture, because those can be signs that this is further down the pipe for you if you don't get genetic testing and stop it before it starts. The great folks at the Cleveland Clinic and the folks at the Amyloidosis Foundation do genetic testing. That is what they do. They can help you find out if this is something that you have to worry about later on. But if you have something like atrial fibrillation that keeps showing up in different members of your family, you need to be concerned that this may be a cause, because this condition is common in people in the United States as well as Europe as they get older. So it's something that definitely needs to be tested to make sure that you get the appropriate treatment. Now, depending on what they find out is the actual cause of it, depends on how they treat it. So we talked about the treatment options for ATTR in another presentation about the familial type. And we also talked about the treatment options for AL, if it turns out being with associated with the light chains. We talked about the associated cancers with that type too, so make sure you look at the AL presentation of amyloidosis if you need further information on that. But if you are looking for genetic testing or typing or anything to determine if you have a family history of this in your family, or if you have a problem with it and nobody in your family has picked up on it till now, because this didn't they didn't start talking about this till recently. If you want genetic testing and all that, make sure you either contact the Amyloidosis Foundation or the Cleveland Clinic because they do the testing. I want to thank you for being here today. I know there's a lot of things that you could be doing with your time. I try to keep this as brief as possible, but yet give you a lot of good information so you can dig for more information if you want it. If you have any specific questions or comments, please leave them at the bottom of the presentation and I'll be glad to review them. You can also feel free to email me at rnforhealthieryou@gmail.com if you have specific questions but you don't want to post it where everybody is going to be able to see it. I do make everything so I review it before it's actually posted, so you can feel comfortable that all your information is not going to get out there. But if you are hesitant about listing anything personally or asking a question personally, feel free to drop me an email. I'll be more than happy to answer it. Please remember to like and subscribe so you can help me with the channel and getting YouTube to recognize that, hey, people really are watching this. They really are listening to this information. This is something that we need to keep going. And hit the notification bell if you want to know when I do a new video so you can review the content. Make sure you share this information with anybody that you think may find it helpful, especially if you have somebody that you know has early onset of carpal tunnel, has had an early in life rupture, tear of a bicep muscle or tendon, or if you have somebody that has spinal stenosis. If you know anybody that has any of those conditions, those are the 3 warning signs before you get to the age of the wild type actually setting in to be a problem. Now, the pharmaceutical companies really didn't start covering this condition until earlier this year. It was a big thing that they covered this year in the nursing conferences. And it was the first time that I had really seen it talked about at any great length. So if this is new information for you, if this is something that you are not familiar with, you are not alone, because this is something that they are really just now starting to focus on as being a precursor to other types of diseases and illnesses later on down the line. So I look forward to seeing you guys again soon. I am going to be doing my next presentation on something very generic like hypertension, to try to give you something that's more mainstream in focus and not something that has to do with such rare conditions, because I want it to be able to be applied to a greater number of people and for a greater number of people to receive benefit from the information and it not be just focused on a particular area or a particular illness. So this concludes the amyloidosis series. I hope you got something out of it. Again, any feedback is welcomed. Feel free to email me. And there are some other places on the following page. Feel free to look me up on the other places where I have videos. There are videos that I have posted there that I cannot post on YouTube. So just be sure to check me out the other places and see if there's other material there that you might be interested in that I can't post here. Thank you so much, you guys. You have a wonderful week. And if you have any questions or comments, please let me know. Thanks, guys. Have a good one.